Everyone deserves to feel safe in their community. Community First Responder Program lets civilians respond to people in the community who need help.
We're not with the police, we're with Albuquerque Community Safety Department. We respond to 911 calls that aren't anything violent or anything. We just check on people to make sure that they're okay.
Every interaction should start by bringing empathy to the incident. We have to develop a connection with the individual and offering any service, even if it's a basic bottle of water and a blanket. And then the final piece of that puzzle is connecting to the broader service community that is available.
With HEART, there's follow-up care. There are people who check on you and will link you to other resources in the community to make sure that you're getting the help you need.
We had a woman who was in her 90s living on the steps of the Oakland Public Library. It took us almost 2 months of visiting her and learning about her and getting her to open up. Finally, we were able to find out that there was family in Sacramento, and they had been trying to find her and reach out, and they were able to take her from living on the street and getting her home into their care. That is one of the best wins we've ever had.
There are times when people need help, but they don't need cops.
Police have been asked to be everything for everyone, forever.
The HEART program takes some of the burden off of our other first responders to deal with these kinds of calls. It allows them to focus their efforts on violent crime and on issues that utilize their skills. People are afraid to call 911 for a relative who's having a mental health crisis because they know that those sometimes end in violence. Police officers are not trained to handle mental health crises in the way that community first responders are trained.
How do we evolve public safety in a way that now meets the demand that we have as a community around mental and behavioral health?
You don't need a police intervention for a mental health crisis. You need people who have the skills that are necessary to make someone feel safe, de-escalate the crisis.
For us, safety is patience. It's time. It's slowing everything down, trying to keep everybody cool.
If people are getting dedicated real help for their mental and behavioral illnesses, it actually saves us money from the public safety standpoint. We're seeing decrease in 911 calls. Police are starting to see the benefit.
We now have the opportunity to provide our residents with support without exposing them to negative interactions with the criminal legal system.
This is the evolution of what 911 could look like as we move forward.
It's about getting people the right help at the right time.